Aging. Oh, and I am very excited to be here to be the host and moderator for this month's webinar through the lens of first responders, falls and falls prevention. So before we get started, let's go over some quick Zoom housekeeping. First and foremost, you are automatically muted. You will not be able to see other participants, but you should see and hear speakers and hosts. If you don't, let us know in the chat and we'll troubleshoot however the best we can. We do ask that you put any questions via the chat box. Those will be answered at the end of today's panel, and that the session is being recorded. There's no formal PowerPoint, but any resources that are discussed today, we will be compiling a list and that will be sent out afterwards. So, and then the webinar will be posted on our website. All right, so like I said, thank you for coming to the special webinar panel today. Some of you might know, but September is Falls Prevention Awareness Month, and we wanted to take a different spin on this topic, and we reached out to Maria, Lee, and Angela to plan this presentation about how first responders react to falls. So before diving too much into the discussion, I just wanted to provide a quick high-level overview about falls and their impact on older adults. First and foremost, 1 in 4 Americans 65 and older fall each year. In 2021, falls caused 38,000 deaths and at least 3 million emergency room visits. In 2020, the total cost or the total healthcare cost of just the non-fatal falls was $80 billion. People with hearing loss are nearly 3 times more likely to fall, and fear of falling can impact an older adult's quality of life. So these are statistics that indicate the significant impact falls have on older adults as well as its prevalence. It is definitely a topic area that should be discussed more so that society can become more educated about the serious issue. And so with that, let's go ahead and begin the panel discussion so we can learn more about first responders' perspective of falls and falls prevention. And I am going to unshare my screen. And what I'm going to do next is ask for our panelists to introduce themselves, starting with Maria.
Good morning, everyone. My name is Maria Boston. I am a fire educator with Charlotte Fire Department. I've been in the fire service for almost 22 years, and almost 3 of those have been with Charlotte Fire. And I appreciate you listening to us today. Thank you.
Lee?
So good morning. I am Lee Kish with Gaston County Office of Emergency Management and Fire Services. I am at about 21 years in fire services. I started my career as a 911 dispatcher and then became a fire inspector, and now I'm a fire and life safety educator.
All right, and Angela.
Hi, I'm Angela Swift. I am an injury prevention registry nurse for Caremont Health, and I work with trauma services. I've been an ER trauma nurse for over 22 years. And in that time, I've also worked with EMS, fire, and police during that time, and have done a little bit of everything with falls and all kinds of injury prevention.
All right, wonderful. Thank you so much. All right, so first, our next question, from the first responders' perspective, what kind of resources are available for older adults who have fallen? And I'm going to start with Lee this time.
So the short answer is it depends. There's no cookie cutter answer for this in terms of what you're going to get resource-wise when you fall. It depends on if you're injured or not injured in some cases, depending on where you live as to who's going to help you. For instance, if you live in Charlotte, in Mecklenburg, and you call 911 and you say, I'm not injured, the Charlotte Fire Department's going to come help you. But if you say I'm injured, then you're going to get an ambulance. But out here in our county where we live in Gaston County, if you're in the city of Gastonia, you might get one thing, but out in the county, you're going to get something else. You're always going to get an ambulance and maybe not a fire response because not all of the fire departments respond. So your best practice is get to know your fire departments and your first responders. Most fire departments are happy to have you come visit. They want you to come visit. Get to know them and ask the questions so you know what you're going to get or not get, as the case may be, when you fall and when you're injured. That's the best thing you can do.
Okay.
One of the things that you said something that made me think about it, and that's response. Depending on where you live, like Lee said, you may get a different type vehicle. Some larger departments may send a fire engine. Some smaller departments may have a squad, which might look like a little mechanical truck, or they might send a marked SUV or just a general truck with a couple people on it, depending on how they're doing their medical response. We often get questions, and I don't know, Lee knows this from being a dispatcher. We often get questions like, it's not super serious. Can you please not alert the neighbors? Can you not come lights and sirens? And I think it's really important for everyone to know that here in North Carolina, I think we have some people that may be in another state, but at least in North Carolina, it is a state law that they run lights and sirens when they're going emergency response.
Yeah.
So asking, can y'all just be quiet? Don't wake the neighbors. Or why does it take so many firefighters to come? I wasn't that hurt. Couldn't one of you just come? It kind of depends on your agency. So I just wanted to make sure everybody knew that.
All right. All right. So, with that, let's just say an older adult calls 911 stating that they have fallen. What is information that dispatchers will be collecting during this call?
So the very first thing we want to know is what happened and where you are. Those are two vital pieces of information. And I know people get frustrated with all the questions that are asked when we call 911. What I can tell you right away, as soon as we have an address in a situation, something is dispatched. Regardless of all the questions you're getting, someone has been dispatched as soon as there's an address in a situation. The rest of the information being collected is being given to the responding units as we're collecting it. And it's maybe sending additional equipment possibly later, but that address and situation has already started something coming, usually in most cases. So don't get frustrated with the additional questions. That's just adding information that we need along the way. However, we do get a lot of things, and I wanted to touch on this, and Maria actually mentioned some of it, like, do you have to bring the whole truck? We always have to bring the whole truck. It's coming no matter what. Something that I've learned recently with older adults and falls that has happened a lot is people will fall, but they won't call us until the next day because they don't want to bother us. You are not bothering us. Let us know as soon as it happens so we can get you what you need right away. We are there 24 hours a day at 911, in the fire stations, in the EMS stations. We're always there. So call us as soon as you are hurt. You're not bothering us, but people will also ask us on 911 to tell the firefighters to take their shoes off, or again, not to bring the whole truck, not to use the lights and sirens. They don't want the neighbors to know. They don't want their kids to know. These are things we cannot accommodate. So don't ask us those questions because we're probably not going to accommodate you if you do ask us those questions. We've also had people say, I'm not hurt, but my pride is, and we understand that, and we are going to do everything we can to make you comfortable along the way and make you feel better. We get it. We understand. So we're going to ask you all the questions, but be honest with us. Don't be embarrassed. Tell us everything and be honest with us so we can get you what you need to get you the help that you need. I think that's the biggest thing.
I think one of the things we were talking about, and Lee brought it to my attention, was that dead weight is dead weight. And so 100 pounds dead weight is a lot of weight for responders. And so if someone, did you have an amount? Was it 250 pounds?
I'm not sure.
I think somebody recently told me, like, if depending on the person's weight, if it's over a certain amount, that the responders need to know that. The
Oh, yeah.
dispatch needs
Yes.
to know that, so
You're
that
right.
they plan the number of people and the equipment that they're going to use to get that person out to get
That's
help.
important information for them. Certainly, if it's a bariatric unit or something like
Yeah.
that, that's a different kind of unit that might need to respond. So that's important, vital information we need coming in.
It's a different kind of stretcher that they use. And so they might have to send a different unit that carries that stretcher. And one other thing that is good to know, that for the people that are afraid to call and they want to wait until, I'll just wait till morning so I don't wake anybody up. There's some medical implications that can happen the longer you wait when you're sitting there on the floor and not moving. It can make your body do some pretty bad things while you're not moving there. It can cause your body to get sicker. Even though you think you're not hurt, you not moving for that amount of time can hurt the inside of your body, and you don't want to do that. Whether it's you sitting there on the floor and it's hurting your skin, if by chance that you've spilled something, if you're sitting in some sort of fluid, if there's a chance that you may have had an accident and that fluid is on your skin. There's all kinds of things. If you did actually hurt yourself, there's all kinds of things that could be happening to your body during that time that over time could be getting worse. So waiting is not helping the medical and emergency professionals. It's not doing them, and you're not helping them. And you're definitely not helping yourself. So you want to be able to, as soon as anything happens, get a hold of somebody and help us help you.
If I can kind of add to, since we're talking about the dispatch section of it, a lot of times there are things you can do in advance to prepare for calling for any emergency. I know that there are a lot of people that have the life alert or other type system that they keep with them, and then check with your local medical supply company. Some of them are not monitored. That may be a more economical solution. I know in the community I came from and in the city of Charlotte, we have First Due, which is our records management system, and people can go into Community Connect and they can go ahead and put in information. For example, if we had it in my community when we lived with my mom, I could have put that where her bedroom was and that she walked with the assistance of a walker. That's important for first responders for falls calls. That's important for fire and evacuation calls, things like that. And then there are some communities where you can put in CAD notes. So CAD is our dispatch system. And so the dispatcher would be able to see something of importance when that call type comes in to that address, and then they would be able to report that to the dispatcher. Like mom's in the back bedroom and generally is confined to her bed most of the day or something like that. So CAD notes, First Due, and Life Alert and other devices to go ahead when you can't reach the phone.
When I'll always piggyback on that. When I teach my older adults, I tell them, keep your phone with you. Just keep your phone with you. When you go to bed at night, keep it on your bedside table. A lot of us don't have a landline anymore. A lot of older adults don't have landlines anymore. We've all gone, I built my house without a place to have a landline. That's normal, but keep your phone with you. Don't leave it laying in the other room. And there's a lot of ways to call 911 without actually opening your phone, going through a passcode and dialing 911. you have the emergency screen on your locked phone where if you just touch the phone, it says emergency at the bottom. You can also press and hold on Apple phones. I don't know as much about the Google phones or the Androids, but on Apple phones, if you press and hold the top two buttons, it will go into what we call SOS mode. And if you just keep holding it, it will dial on its own if you don't tell it to. But there's also an app you can download called What, the number 3 and words, What 3 words. And when you open that app, it will give you 3 words. And when you've called 911, it doesn't call 911 for you, but when you call 911, it's giving you 3 random words, and it helps pinpoint your location for a dispatcher. So if you don't know where you are, or you cannot remember your address, if you tell the dispatcher those 3 words that it's giving you on your phone, it's telling them where you are. So especially for people who have moved, we all know our address from 40 years ago, but sometimes we don't remember where we are right now, or maybe you're out in public and you just don't know where you are. You don't know the address of the store you're in or something like that. It's telling you within an almost exact location, within 10, 15 feet where you are. And that's going to help the dispatchers get help to you very quickly. Because knowing where you are is key. Because saying I'm at Walmart doesn't really help them. There's a lot of Walmarts, and saying I'm at the Blue House near Walmart doesn't help them. But that app will really help pinpoint your location.
And that's some really great information. Are there any like common barriers that dispatchers experience?
I think don't let language scare people. If there's anyone where, especially English isn't your first language, I think people not native to this country are often afraid to call or don't know they can call. We have something called Language Line. So if English is not your first language, somehow if we can get that messaging out there still to call. One, they don't know about 911 because it's not the common number in other countries. We need to be better at getting the messaging out there to call 911, and that we have Language Line to get to almost any language you can think of. So don't be afraid to call. We also have TTY, so deaf and hard of hearing. We have a way to communicate with them in all comm centers. That's a requirement in all comm centers. And many comm centers, not all, many are now using text to 911, though it's not our favorite thing to use because it does delay the process.
Yeah, that's some really, really, really great and useful information. All right, so the dispatcher receives the information needed and sends help. So upon arrival, what should one expect to experience? And I'm gonna let Maria start us off.
Okay, well, let's talk about a few minutes before arrival. First of all, can they find you? Is your house light on? Were you able to someone in the house able to turn on the house light if it was at night? Can they see the house numbers? Are your house numbers visible on your mailbox? Are they visible on your house? Have the bushes grown up over the numbers? Or are they on the front door, but you've opened that door and now they're behind the door and we can't see you? So think about those kinds of things. Other barriers might be, is there a gate that maybe is kind of rusty, is hard to open? Are there outside dogs or animals that might delay our response? All those would be things that you would want to think about. And then once they get inside, we have people that'll say, "Oh, honey, I don't like shoes. Can y'all 4 people, do you mind taking off your shoes?" Well, that delays our response getting to the person. Is there clutter? Is it narrow pathways? You talked about the stretchers. The stretchers nowadays are not very big at all. I'm going to be honest, I would probably need a bariatric stretcher because they're tiny. But still, can we get that in? Can we navigate it down into the home, near the bathroom, near the bedroom, wherever the person has fallen? Are there indoor dogs or other animals that may delay our response? And then again, I think just signs of clutter and being at furniture placement, rugs, some of the things that might aid in a person falling might also be barriers for the firefighters, for their equipment, and for the stretchers and the medics and things like that. Rugs that are curling up, uneven floor, things on the floor, all those kinds of things. You want to help? Anybody want to help me out with that?
Covered that one pretty
Oh,
well.
okay.
Yeah.
All right. All right. Can you give us some pro tips on what an older adult or even a caregiver can do to help be prepared for the arrival of first responders? And
I'll start with one. You mentioned something in your opening, and I had an aha moment. You talked about hearing loss and
Mhm.
how hearing loss can lead to falls. We want to make sure that not all anyone out there can purchase a deaf and hard of hearing alarm that works with their smoke alarm, and some communities actually give those away for free. I know
Red
when I worked in
Cross.
Kannapolis, they had them. Red Cross has them. Charlotte Fire Department has a limited number of those. We don't just hand it to the caregiver.
Install them.
We install them. We have to make sure it works with the smoke alarm. So I know that's going a little off topic, but I did want to make sure I didn't forget it. I want people to know that if you need them, look for community helpers or look up a reputable company online. They're probably $250.
Probably that
$2.99.
now, probably.
But
They're
the
not
ones
cheap.
we recommend are portable. You go stay at your friend's beach condo for a week, you take it with you.
You get.
Yeah.
Almost at that.
Thanks.
There's smoke detectors.
And then, so some other things I think that we had talked about, again, just going back and talking about the caregivers with having information already in the CAD system or knowing how to get first due or something like that. Knox box,
I
the
was gonna say the
residential,
box.
I'll let you talk on the residential Knox box
The
or the Knox
boxes.
boxes.
If your community is what we call a Knox box community, not all communities use them. It's a brand, KNOX, like Fort Knox, Knox box. And you can go online to their website, put in your zip code. And if usually it's your fire department comes up, that's how you know if your local jurisdiction is using Knox boxes or not. You can purchase a residential Knox box and make sure you get the residential one because they're not cheap, but they're not supposed to be cheap. They are very well-made key boxes that go mount over your door, and you won't even be able to unlock it. Your local fire department usually is the one who comes out. They have keys. No one else has the key. They come, they unlock it. You put your key to your home in it. They lock it back up, and that way, if they have to respond, they can get into your home without having to break your door down. It's way cheaper than a new door. That's the upside to it. Other ways you can get around that is you can buy one of those coded boxes, or if you even have a coded door lock that you can set a code just for first responders. A lot of these electronic doors, you can put your own multiple codes into them and set a code just for first responders, and then have those CAD notes we were talking about put in. Call your local comm center or put in a Community Connect note that there is a code just for first responders to get into your home, which are all, once again, much cheaper alternatives to doors, replacing doors. Fire trucks carry what we refer to as universal keys, and those are generally axes and pike poles that they will use to get through your door if they absolutely have to get to you. They will do whatever it takes to get into your home when it comes to saving your life, if they think that's the alternative.
My mother didn't know it, but we certainly had the keyed code system and put a CAD note in for her address. We worked in Charlotte during the day and she was in Concord. So she never knew they had it, but we had that. We had called and had dispatch notified what the door code would be were she to fall or have another medical emergency and us not be close by.
Yeah.
I think a lot of people still want to refer to the key under the flower pot
or a rock
or, you know, it'll be under the rock or the little statue of the gnome. And we understand why someone might think that would be safe, but honestly, there are bad people in the world and bad people watch things. And if they see the same family member coming in there, always lifting up the gnome or the flower pot and then going into that house, then they figure out real quickly what must be under there. So we have to come up with other creative ways so that that doesn't happen.
Also, when you're thinking about having things ready, just in case, things ready for, first responders, always have a list of medications that you're taking, an updated list of medications that you're taking. And not a bag of medications. You don't want to bring your medications to the hospital, but that updated list of medications and your medical history along with your surgical history. That way you can just take that list, that piece of paper that has all of your medications and your medical history can come with you. And on that piece of paper or that maybe a little notebook that has that information, your contact information, like who somebody needs to call in case of an emergency, those things that aren't going to be always in your memory, because during that time you might be flustered. I can remember my first phone number and my first address, but I cannot tell you what, all of my addresses since I got a cell phone, because everything is in here. Because before we used to memorize those things. Now I can't remember all that stuff. So having all that stuff in one place is always a good idea. These are the things that you can grab or EMS you can say, hey, it's right over there. They can grab it and have it. They can have that information handy, and then they can also give it to the hospital when they get there. They can give it to registration, so they'll have your insurance information, your contact information, all of your important numbers. So it can be passed along and then given back to you, and you can keep it there in the hospital. But anything that you might need while you're in the hospital, and don't bring anything with you that you won't need. If you can't even see to sign a piece of paper, yes, of course, bring your glasses, but you don't need to bring your whole purse if you don't need your whole purse. You don't need to bring a wallet full of cash. You don't need to bring, your computer. Or a lot of people, of course, will not leave anywhere without their cell phone, but know that, keep it close to you. Because things happen between the ambulance and they get lost in the bed sheets, and things that you want to bring, just keep close to you. Don't bring a bunch of things that are worth a lot of money because things get lost. Only brings the things that you want to keep with you. Like I said, bring the list of medications, not the medications, because any medications that you bring with you will be sent into probably some places they'll send them down to the pharmacy to hold. They're not going to let you keep them there in the room with you.
I think, did we say a lot of times we tell people keep that list posted on your refrigerator?
Yeah, either on someplace
Somewhere where they know to look,
they'll-
they can.
they'll look, in case you're not able to tell them right then. A lot of people, they'll keep, or if they keep all their medications like in a line on their counter, they'll keep their medication list right next to it. I mean, easy to find kind of places.
A
Some
go
people
bag
have
is smart,
yeah.
like just a little bag you can
little-
grab going out the door that has all that stuff ready to go.
Yeah. An extra pair of reading glasses.
Mhm.
So.
And Lee touched on the residential Knox box program. If some people think, oh, I'll put my medication list inside that secured key box as an added step, that's great and all, but a lot of us change our medication. Like I'm just thinking about myself, and in the past year, a couple things have changed.
You can't.
So it might be easier to keep a note in there that says medication list is on the fridge or beside the bed or something like that. That will help first responders know where to find it without having to have the actual list. The updated list is beside the bed or on the fridge.
Or even there's programs like, I know, Caramont uses My Chart.
Mhm.
You could, and a lot of places use My Chart.
Yeah.
There's a lot of hospitals that are connected by My Chart. As long as that My Chart is updated, you could just say my medications are all updated on My Chart. And I took my last medications at 8 o'clock today. So that list is updated. I don't need to bring any of my medications. We're good to go.
Perfect. All right. So in this case, the older adult who has fallen has been deemed to go to the hospital. They are transported to the emergency room. What happens during that ride and what happens when they arrive?
That is usually a case by case basis, depending on if they're hurt. And let's say they're hurt, but it's not life threatening. If it's not life threatening, of course, as soon as you get into that ER, and this, I can only speak from the ER that I work in. Now I have worked in other ERs. They'll come in and they'll get registered, and that's where those numbers that we wrote down before are helpful in case we can't remember them, but they'll get registered. Somebody in registration will come and just get their name and information, and so they'll get an arm bracelet. And that way they are now a person. All right. And so once they are put in the system, then we can put them in a room. In most cases, we are able to put people in a room if they are injured, but there's always a possibility that, like during flu season or something like that, that some people may have to go to triage. An ambulance is not always a straight ticket to a room, unfortunately. But you know, everything is gone by the severity of an injury, and everything has to go by a triage assessment. So once they are given an arm bracelet, they'll be assigned a destination. So if that destination is a room, they'll go to the room, and the nurse and the doctor will either, the doctor will already be in there. If not, the nurse will be. The EMS will give the nurse report. The nurse and likely a tech will get vitals, and the nurse will do an assessment. If the doctor's in there at that time, he will also do an assessment. Depending on the severity of the injury, if it is considered a trauma, there'll be a lot more people in the room, but there'll be a trauma assessment, and they'll start making a plan of what's going to happen. There may be some x-rays, there may be some, you might go to other departments to get some tests done. You might get an IV line if one wasn't done by EMS. You might get medications by mouth or by IV. Really, everything from that point is decided depending on the severity of the injury, and what happened. Why did you fall? What made you fall? Did you trip? Did you get dizzy? That is a big thing. We have to determine what caused the fall, because if it was something that you tripped on, let's say it was a rumpled up carpet, or you stumbled over cords, you know, that was an accident. But if it was because you got dizzy, and it could have been either a neurological event or maybe even a cardiac event, that's a whole nother rabbit hole we need to look down. And that could be even a longer stay in the hospital, but a totally different kind of assessment, workup, and a different floor in the hospital. So everything is kind of, you know,
Maybes and what ifs.
Maybes and what ifs, exactly. You know, we gotta decide what direction to go, you know, what hall to go down. And that depends on you.
Definitely situational.
Yeah.
When we were prepping, you had mentioned that usually with falls among older adults, during that assessment, there will be questions about elder abuse. Is that correct?
We usually ask, and this is not just with, this is a standard question that we ask everybody that comes in. Do you feel safe in your home? Does anybody threaten or abuse you? And this is something we ask everybody that comes into our emergency department, not just elderly, not just children, not just women, not just men. It's a question we ask everybody. And sometimes we get looks like, no. And sometimes we get looks like, who told you to ask me that? So those are the people that I'm like, nobody told me to ask me that. Why? Why do you think somebody told me? And that's where we might want to do a little bit extra, you know, kid gloves. So sometimes there is a situation where neglect or abuse could be a problem.
I know that's a whole different situation. Again, situational, but you know, in the field that you are in and what I'm in, we're mandated reporters. So it's
Yes.
important to just know that anybody who's coming in for this type of situation, that question will be asked. And it shouldn't be where people feel offended. It's just us making sure that that individual is safe. Okay.
And we have
Right.
to report it for the safety of everybody, whether, you know, it's somebody who's one of our littles or one of our elderly. You know, it's the people that can't report it themselves. We have to take care of the people in our community.
Of course. Yes. And then I know that you also mentioned when we were prepping that if there's extra support needed, that they can always chat with the social worker at the
Mhm.
hospital.
Yep. When they're admitted, now when people are discharged from the ER, it's not, we can always ask to have a social work consult if they get discharged from the ER, but when they're admitted and then discharged from the hospital, usually that discharge planning is always reviewed by a caseworker. So that usually gets reviewed. So, you know, we get to have that that extra care. But if it's not needed for admit, then sometimes you have to do that extra assessment to decide, do they need maybe somebody to just take an extra look? And sometimes, you know, you'll get that nurse that's like, maybe a social work consult might be a good idea. And sometimes we'll get EMS that says, hey, you know, when we looked in this house, there was, I mean, she is a 92-year-old female who is really rocking it out. She is doing a good job, but she has got so much furniture and it is hard for her to get through there. And maybe somebody just needs to do an assessment of the home, just kind of to help her out. And, you know, that can kind of trigger, you know, hey, maybe somebody just will do a social work consult. You know, not a bad idea.
Well, thank you. Okay. So tell us where first responders see older adults falling the most. And whoever wants to start.
I think we could say it in unison.
Yeah. Well, I'll tell you, working in trauma services, we get to see, we work with the registry. And so we get to see the stats a lot. And we're seeing a lot of people, it's falling out of bed is a big thing. And you wouldn't think how you fall out of bed. It's not so much you're just rolling out of bed. It's not like, you just forgot where the ends of your bed were. It's getting out of bed a little too fast, maybe in the middle of the night. Cause I mean, how many times have you gotten out of bed in the middle of the night and you got up too fast and it was like, whoa. It's getting out of bed, standing up too fast to go to the bathroom in the middle of the night. And you just, when you got up, you kind of kept going forward. That happens a lot. And on the way down, there was that table that has always been there, but this time it just it jumped up and hit you on the way down. So there's the getting up too fast in the middle of the night or getting up in the morning too fast. So getting out of bed. Also, there's always getting up from the toilet is another a big one. Or getting out of the shower. You get that really good hot shower and it felt so good, but you get out of it and your vasculature is good and wide open and you're nice and hot. Unfortunately, that also kind of makes you a little dizzy sometimes. And you get out of that shower and you hit the ground. Not always, I mean, it makes you feel really good and nice and warm, but it also can kind of make you a little dizzy. Bathrooms also, when you get out of the shower, are a little slippery. So we have to take that into consideration. So sometimes it's good to have those absorbing, I like the stone ones, because then they don't bunch up on you. They're good absorbing stone placemats, I guess,
Sure.
or
Yeah.
mats. But something like
The
that,
slip things.
the slip
Any
things.
slip things,
Where else?
the flat surfaces. Not flat,
Any-
they're not flat because they're cords and rugs.
Yes.
and-
Any flat surfaces, which
Right.
sounds silly, but flat surfaces that then we'll put rugs on to cover up cords.
With animals.
So you're sitting, you have a cord going across a room, so you put a rug on it. Well, those will bunch up, you trip. So rugs and cords are big ones. And then also, pets are a wonderful thing to have as we get older because mental health, they're a companion, they're great, they keep us active, which helps with balance if you stay active, but sometimes they get excited and run around our legs and trip us up. So there is that. So we have to be a little bit careful when we're walking our dogs. There's also something about getting the mail. When we get the mail, I don't know how treacherous our walk to the mail is, but I almost forgot to tell about that one. The walk to the mailbox,
Something about
sometimes I don't know if we're just not, why there's so many holes on the way to the mailbox, but I've been seeing that one a lot lately.
Interesting.
Well, as like
Need to-
tree roots grow, like if you think
Yeah,
about
you
it,
need
as
to
tree roots
mailbox.
grow, like I'll be honest, we have a house that was built in the 60s. And so what once was very level sidewalks, as the tree roots grow, like there's parts of the sidewalk that are a little uneven now. Like one side's higher than the other because of the way the tree's
Yeah.
growing and things like that.
I wonder if it's because we're walking so closely to the edge of something,
Maybe.
on the edge of a sidewalk and on the edge of a
road or
a road
street
that
or-
we're more worried about that than we are watching where we're walking. But walking to the mailbox
Interesting.
is a good place to fall.
And making sure that like steps have handrails and things like that. The handrails are replaced. We have a coworker whose parent last year fell because of the handrail gave way when they had to use it. They went to lean on it, and so that's had to be replaced. To make and maybe some environmental modifications.
Maintenance.
Yeah.
Basic maintenance.
Those are our big ones.
That's good.
Gravity is,
A beast.
it's a constant.
Tricky.
It's a
Very,
Darn
very
gravity
tricky.
will get you every time.
Yes. I mean, while we're on this topic, would you like to share any additional tips and tricks for preventing falls?
Lighting, good lighting. Light the way.
Mhm.
Shoes.
Shoes matter.
Shoes. If I could get my oldest sister out of those flip flops, those Tommy Hilfiger flip flops, and into some shoes that have some ankle support, that would be fantastic.
Mm.
Don't tell her anybody that I said that.
Pick your
But-
feet up. Stay active and pick your feet up when you walk.
Staying active is an excellent way to prevent falls. And the CDC has done lots of research about how staying active has prevented falls. One of which has proven that like Tai Chi has helped prevent falls. And there is actually classes on Tai Chi to prevent falls that you can take. And it's super easy. It's good for arthritis. And it helps you with balance. It helps with, I mean, there's Tai Chi out there that helps with balance, cardiac issues. I mean, it's great for all kinds of things. So, I mean, just staying active alone.
Don't you do you teach that or matter of balance?
Tai Chi.
Do you teach Tai Chi? Instructor.
Chair yoga also
Mhm.
is a good one. Again, all the things that keep your body in motion.
Anything that keeps you in motion. Your muscles have memory, and after 3 days of not moving, they forget what they've done. So
Exactly.
stay active.
Stay active. Also, talk to your doctor about your medications. If you feel like you're falling a lot, take a look at your medications and see if maybe it might have something to do with that. Are you on a lot of medications that might make you dizzy? Are some of your medications, do you need to be on them all? Because sometimes, you know, if you go to several different doctors, one doctor might not. Now with like certain computer things, our doctors can communicate with each other. They can see all the medications, but some doctors, you know, don't always get on those programs. So they can't see all the medications you're on. So they'll be like, oh, I'm going to put you on this, but they don't know that you're on this and this and this. And so that medication added to those can kind of be a lot. And they can all make you kind of dizzy. So maybe you should just kind of look at all your meds and talk to your primary care and say, hey, is this all too much for me? Could this be contributing to my falls? Because I feel like, you know, gravity has really been the winner lately.
To piggyback on that, you can also go to a pharmacy and do a medication reconciliation and make sure they know all the vitamins you're taking, everything, because a pharmacist can look at all of that and say, you know, you're taking this medicine at the same time you're taking this medicine, and it's too much of the same thing at the same time.
Yeah.
And that's what those pharmacists went to school to do. And they're like, wait a minute, you're taking this vitamin. Does your doctor know you're taking this vitamin? Because sometimes you forget to tell your doctor everything you're taking. So if you do that medication reconciliation, they can really go through there and figure out everything you're taking and what's interacting with what and when you're taking it.
And if there's foods that
Yeah.
you shouldn't be eating with them.
Yeah.
I know that when we were prepping, Lee, I think you said that you teach the steps to safety.
Correct.
Yeah.
Yes, so the National Fire Protection Association has created a program called Steps to Safety. It is designed for seniors. It's both fall and fire prevention. It's a national program, so if you call around to your local, usually fire educators, there's other organizations that do it too, but primarily it's fire educators that teach it, or call your local fire department. They might be able to tell you who teaches it if they teach it, but we teach it nationally. And it's a fun program designed for older adults, but it's both fire and fall prevention. We love teaching it. We both teach it.
And it's all the materials are on the NFPA website and they're free. So it could be such that maybe there's someone that does in-home health. Maybe they print off some of the materials and they do it to the 5 homes they go and visit during the week. Anyone can use it. It doesn't have to be a certified fire and life safety educator to be able to use their outlines and their lesson plans and the little handouts that go along with that program.
There's home safety checklists. There's all sorts of stuff you can get out of it. We primarily do the group classes, but they also have in-home safety visits that come out of that as well.
That do a lot of what we've been talking about today.
Yeah.
Are there cords that have carpets over them? Is there narrow pathways? Are there animals that might cause a person to trip and fall? Medicine, shoes, all those things. A lot of those things are covered in steps to safety.
And there may also be a paramedicine situation in your county that could do a home visit. Certain counties have paramedics that do in-home assessments.
Yeah, that's really good. I didn't realize that you can translate some of those programs and use it at individual basis or like in the workforce. I really like your perspective of like maybe in-home aid workers going in and using that or just having it on hand.
Yeah. And we'd be happy
Yeah.
to talk to someone, like if someone feels like they need a little bit of train the trainer
Yes.
to be able to do it effectively, that's definitely in our wheelhouse.
NFPA wants you to partner with people because they know that like organizations like ours can't possibly do the in-home visits. So if they can find a partner agency that can, that's the goal of this program.
And most agencies like to partner. I know we
Yes.
like to partner.
We love to partner.
We love collaboration.
Good. We do too at the local AAA. Before we do like a wrap up and answer questions, because we do have some, Maria, I know you had mentioned about the Hope Line and Meals on Wheels. If you want to
Yes.
just quickly touch base on that, then we'll move forward.
Absolutely. Just a couple things to think about. A lot of times, some older adults might experience social isolation. So when I was thinking about this, I thought about Meals on Wheels or other drop-in services where, that helps us too. If I'm delivering Meals on Wheels and I know I get to Miss Cheney's house and she doesn't answer the phone, I know to immediately call back to Meals on Wheels, and they have another number. They can call a family member or a caregiver and see what's going on. And if we can't get someone, it may end up that parent or that caregiver will come out or they'll send someone. We've actually had people that have fallen or had other medical issues that's how the caregiver found out, was through a Meals on Wheel visit. Also, some faith-based organizations may have something where they visit people in their community that don't get out much. Maybe they take a little trinket or gift or do just random calls. And then in North Carolina, we have the North Carolina Baptist Aging Ministry. They are out of Thomasville, North Carolina, but they service all older adults in North Carolina, and they have 3 main programs. They do smoke alarm installations, they do ramps for older adults, and then they also have what they call One Hope, which is their isolation hotline. So anyone can call in. I believe it's 8 a.m. it's 9 a.m. to 9 p.m. It's those calls are answered by trained volunteers. A lot of them are nurses and people that work in the healthcare industry. And you do not have to be a member of a Baptist organization or any faith-based organization to put a call in. And I know that we've talked to people that answer those phone calls, and sometimes they talk to the same person every day, and it's kind of a catch up. Like,
Yeah.
what have you been doing? What have you done since yesterday? And things like that. So I think it is as meaningful for the people that are answering the phones as it is for the people that are calling in. And other states, definitely put it in the chat. If you're from another state and you have something similar to the North Carolina Baptist Aging Ministry, definitely let us know, because when we're in conferences or on Zoom calls with other colleagues from around the country, we like to talk about those
Yeah,
things.
absolutely.
It's always to have great and extra resources available on hand. And I'm just going to do our little plug here. So I know that we learned a lot of information, and I hope everyone else did too. Just as a reminder, your local area agency on aging is available to help with falls and falls prevention among older adults by helping people stay active and safe. So here with Centralina, and I know a lot of other AAAs in the country, we do promote and lead matter balance workshops that promotes falls awareness and prevention. And we here at Centralina, we also train leaders who are interested in implementing this in the community. And then we are also very involved in our local falls prevention coalition. So if you are in our area, Maria and Leah are in our coalition. We would love to have you become involved, and just all you got to do is reach out, and we would be happy to connect with you. All right. So like I said, we definitely have questions. So we'll start answering them. Let's see here. So the first one that we have, it says, my staff have contact with older adults when they deliver meals and or provide services within the home. And when they encounter a medical emergency, they're instructed to call 911 themselves because they believe the call taker wants to speak directly with the person at the scene. And then they said that they also instruct them not to attempt to lift or move someone who has fallen,
Yeah.
since those efforts could exacerbate an unknown injury. From your point of view, are both of these things true?
Sure. Yeah. As a 911 dispatcher, getting the call firsthand from somebody on the scene is always better than a secondhand phone call. Frankly, it's annoying to get that secondhand phone call because you're not able to get all the information you need. And you're asking somebody questions who says, I don't know, so and so called me, so I don't have the answers. So that's frustrating as a dispatcher, because then you're getting the questions from the responding units and all you can tell them is, I don't know. It's what we call a third party call. That's what we refer to them as third party calls. And you can't give the responding units the information they need, and they're kind of going in blind. So to get the call from the scene is always better. And yes, the instructing them not to attempt to lift or move is correct, because you could injure somebody further. I'll let you speak to that a little better than me medically, but
When somebody has an injury, let's say if it's a spinal injury, moving them could actually make that injury worse. If it's a high spinal injury, it could actually cause permanent disabilities. And let's say it's an injury to an arm or leg, and it's misshapen, and it could be causing bleeding. It could cause further bleeding. So depending on that injury, yes, moving them improperly could cause further injury. So without being able to talk to that patient to find out what kind of pain they're having and what kind of injury they have, moving them could make it worse. So that's why both of those things together at the same time makes it very difficult to be even tell you if you should even move them, without talking to them. Both of those things together are true. Yeah.
yeah.
That was a great question,
Yeah,
by the
very
way.
good
Yeah.
question.
Thank you
Really?
for asking that.
Yes. Okay, here's the next one. So it says that we have a family member with fall history. Her home is totally cluttered. It's a hoard situation. Do you have suggestions for her and first responder safety? She doesn't think it's a problem and is reticent to declutter her stuff.
Be careful.
There are agencies out there. I know Lee and I in the past have served on some working groups combating excessive clutter. You may find a company, you may find a faith-based organization. The most important thing it would be to help that person understand why they have excessive clutter,
Yeah.
and that usually comes from a mental health
Yeah.
perspective. Sometimes our possessions become very important to us, and that is we don't want to devalue their things. It's really important to use words like things versus your junk or your trash. And yeah, the biggest situation, the biggest hurdle with excessive things is the mental health perspective.
You can actually trigger them and make it worse.
Yeah.
I'll never forget, I had a firefighter call me one time about a hoarding situation. He said the woman had gone out of town, so her son cleaned up for her and was so proud of them. And I said, you just made the situation worse.
Mhm.
And sure enough, 2 weeks later, she probably had twice as much stuff. You have to be very careful in these situations and keep in mind, don't deem it hoarding just because there's a lot of stuff. The room has to not be able to be used as the room it's intended for to be a genuine hoarding situation. Don't deem somebody a hoarder just because they have a lot of stuff. Be very careful with the classification of hoarding and just a lot of items per se. Don't, I guess, stereotype somebody or put them in a box. How do I want to put that, Maria? Help me with the words I'm trying to come up with, but
Yeah,
be careful.
making them feel bad about their
Yes,
their things and their possessions may exacerbate
yes.
the guilt or whatever emotion they feel towards their item.
But a lot of times there is a very big mental health component to this that's caused this. And
caregivers could seek support as well, because I can imagine what a stress and strain it would be to worry about a loved one that was living in that situation, knowing you wanted to help, but knowing that at the time they weren't receptive to the help. So I would suggest maybe finding a support group or someone that person could talk to talk about their feelings and things behind it.
Probably an online one, because a lot of the people that are in that situation are not big out.
they don't go out. And they don't
Goers.
tend to let us in either.
Yeah.
They'll meet the first responders on the doorstep. They don't
Yeah.
even let them in the house usually.
And I was just going to add, we did a webinar about hoarding a while ago, and I know that Molly's doing a great job of adding the resources that everyone's talking about. But we can add that when we send out the additional like resource list from this presentation, because it was a really good webinar and it addresses what you all have been saying.
Great.
NFPA, we've mentioned them a couple times. If she's throwing things in the chat, NFPA does have a hoarding tip sheet, and it may have some good tips on it that might help that person as well.
All right, perfect. This next question, we did touch on it earlier, but it does say that there are some clients, again, going with that hoarding situation. It says there are some clients that they serve that have hoarding situations. How is that managed during an EMS response? And then they said it can be difficult to navigate the home.
There's, well, sometimes if they can't get a stretcher in, they have other equipment that they can use.
Mhm.
Like different kind of chairs, mega movers, tarps, things like that to try to get the patient out. And that's where it would be good to have like cab notes on the situation in the house so they know to bring that kind of special equipment with them if they don't have it specifically on the truck. And extra lifting help since they won't have the stretcher to pull the patient out. And it's good to know the actual size of the patient so they know if they can actually lift the patient themselves out. Because if you know, if the patient is only 130 pounds versus 330 pounds, getting them through a path is easier, you know, on 130 pounds.
Without causing more injury. And tarp may not have been the exact word, but there are moving
Yeah,
Like a
blankets.
blanket.
And the reason I say tarp, think of tarp material because it would be easily slide across some of, let's say there was clutter, magazines or bags or whatever on the floor. The material of the blanket would kind of slide over that as opposed to like get stuck on it and be hard to move.
First responders are innovative. They figure it
Yeah.
out.
They'll a lot of times they'll MacGyver
MacGyver.
something if they don't have something to use, even if it's the bed sheets from
They
the
do what
bed
they
that
gotta
the
do.
patient is on or from the other room. But it's good to know those things ahead of time.
And the people that are asking these, they'll have our contact information so they can reach out and we can talk a little more about excessive clutter and things like that if they want additional information, or they can watch the webinar that you guys did a couple weeks ago.
Sure. Okay, this next one is very interesting. It's asking what happens when someone says, I'm scared to answer for fear of retaliation repercussion.
Is that maybe in reference to the abuse question?
I'm
See.
guessing that is.
I'm guessing.
Possibly. Mhm.
That's probably the
That's-
first clue that there is abuse would be my,
That's where we would, well, that's where we would go further into that assessment to find out who they would be afraid of, whether it's somebody in the home that they're afraid of retaliation, because we can help with that. And if we need to get law enforcement involved to find out if there has been retaliation in the past, we just have to go further into investigating what has happened. Because a lot of people are afraid of retaliation and repercussion. You know, whether it's from a family member or if it happened because of something that, you know, even from somebody at work or somebody above them, we've had that kind of thing happen as well. So it really depends on the situation, but definitely if somebody says that, we're going to investigate further and definitely get somebody else involved. As soon as somebody gives us the idea that they were abused, we trigger that triggers us to involve social work.
Again, sort of going into that mandated reporter role. Okay. All right, this is another very interesting one. How would one prep or navigate a first responder circumstance for a non-verbal individual?
short answer is it depends. Thanks to technology, that has helped a lot. It depends on the circumstance of being nonverbal, I guess. Whether it be, are they autistic or are they deaf and hard, in its sign language, that sort of situation. With phones, you can do a lot with your phones and communicate through your phones, if they're autistic and nonverbal, that's a whole different situation.
And we would rely on the family member and the caregiver a lot to go off what they're already doing. If they have some type of pictograph system
Right.
where, and some of the
Some
emergency
trucks carry
responders may
those.
have it
Yeah.
where like you rate your pain with your smiley faces
Mhm.
or, what hurts. And there's a picture and if it's the stomach region that might be highlighted or the head might be highlighted, different pictographs and things like that. But we would definitely want to do whatever that person is most responsive with in their home environment or wherever they are. We would rely, I would think, on the caregivers so that we were doing the same, what was most common for that patient, I think is probably what we would rely
I think it
on.
depends on that, the level of the emergency, how quick everybody has to move, and
Mhm.
just what's happening.
I know with, especially with nonverbal autism, if they are not around their normal caregiver, a lot of, I know nursing professionals, a lot of us have have at least taken one or two classes about that, and have the little pictograph
Mhm.
things in the ER, the little sheets, and can show those, and they're easily pulled up on computers, and we have different kind of iPads in the ER and things like that to be able to pull them up. And a lot of autistic nonverbals also have different ways of communicating, whether they have their own device that they use or not. But a lot of times they're not far away from their
Yeah.
caregiver, should that be a situation. Now, there's also that situation where, let's say, if it was a car
Dementia
accident
or
or
adult
something.
too, but
Oh, yeah, but a car accident or something, like I know there's car seats that say nonverbal or something like that, but a dementia patient that might be
it's a whole different.
nonverbal, that could, there's always ways to just try to talk, touch, depending on what they can deal with. Sometimes with dementia, touch might not be okay. You have to just slowly work with the patient and see what they can tolerate, because every patient is different. But whether they can deal with the pictures as well, or you can point, just deal with each patient individually.
And I think that goes back to something Lee said right at the beginning, get to know your local first responders. If you have a family member or you take care of someone who's nonverbal, that might be a nice quick stop 15-minute conversation with your first responders and say, hey, a lot of community members want to get to know their first responders and the responders want to know them. So in your area, you may be able to stop by, introduce yourselves, tell where you live, and just say, this is the person in my home that's going to have a difficult time following your commands or answering your questions. And that's a great one-on-one conversation to have
Yes.
with a first responder.
This is how they communicate, or this is where their communication device is, or they communicate best in calmer environments. Please don't touch them. Please don't have lots of people up in your face. Pick one person to talk to them at a time, things like that. Help us
We don't know.
do
We don't know.
best for them.
Yeah.
So that's like really great advice. And this next question rolls right into it. It's referring to the CAD notes. they're asking how do you access or put in that information?
So in most cases, you can call your local communication center, and you're gonna have to look that up place to place.
They're
How that is,
non-emergency.
yeah, they're non-emergency. Please don't call 911.
Yeah.
They all have a non-emergency number. So you're gonna have to look that up, but it's most of them are called communications. So, it's Gaston County Communications where we are in Charlotte. Unfortunately, you have three in Charlotte. You have Medic, you have Charlotte Fire, and you have Charlotte Mecklenburg Police Department, three different communication centers for the city of Charlotte. So place to place, it's different and it's specific to each place. So wherever you live, you have to look that up and call them and have those CAD notes put in. Now they just got Community Connect, which talk about that a little
Yeah.
bit.
So in the city of Charlotte, we have Community Connect through our records management system, which is called First Do. And it's almost like you already do a pre-assessment of your home and you put that information in for the first responders. So if you have indoor pets, you can put that in the First Do. If you have a person that's bedridden in the back right bedroom, you can put that in First Do. You can put all sorts of things. Do you have gas in the home? Where's your gas meter? And all sorts of different information is available. And the good thing about Community Connect is that you are given the information voluntarily. That's the good thing. But also your contact information is in there, and every 6 months it's going to email you and say, hey, any changes in your home, any changes in your environment or your family structure, let's update First Do, or let's update that Community Connect section to what's most relevant and most current. The thing with the CAD notes, and I think we've forgotten to say it, is as families change, you need to call that communication center. That'll be on you to call and change that. And a lot of times, let's say an older adult's living at home and then they move into an assisted living center. If Lee buys that house and it still says the older adult in the back bedroom, she doesn't know that information is flagged in CAD. So it's up to the parent and caregiver of the person that has moved to say, hey, we don't need that CAD note for that address anymore.
All right, perfect. And with that, unless we get another, couple of questions or comments rolling in, I don't see anything else from participants. Um, do you all have any final thoughts or want to do any type of closing remarks? We appreciate you being here.
No, I
It
had
was our
fun.
pleasure.
I'm glad to be here. I enjoyed it.
Any resources, anything that we can do for older adults, but as well as the caregivers.
Yeah.
Definitely let us know. And there were some people, again, I want to reiterate, there were some people that had questions like the CAD note question. That's a great one. We assume everybody knows how to do
Right.
that and what we mean. So thank you for pointing out that we needed some steps on how to get to that point. If anybody has any questions about clutter or wants us to help Google some reputable things that they can do, definitely let us know. And if you are from out of state, and again, if you've got things that you're doing in your area, definitely throw those in the chat or let us know. Maybe we'll meet at a future conference or something.
Or if you're from one of our counties and you have some
Find us.
ideas or questions for us, feel free to contact us. I'm guessing that she's gonna have our contact information on there, but we're always open to ideas. So definitely here for questions. But yeah, definitely here to help.
Love the
Did you
partner.
see that somebody threw in, thank you for mentioning matter of
Yeah, I
balance?
saw that.
Oh, yeah.
I saw
Yeah,
that.
somebody out there is an
This is
instructor,
their
so thank
master
you
plan.
for what you're doing with
Yeah.
that.
It's gonna take a matter of balance thing too. I've said
All
it,
right.
matter of balance
Nice.
classes.
All right. Well then with that, again, thank you so much for being a part of the panel. Just as a quick reminder, this presentation was recorded and it will be posted on our website. We will send out all of the resources because there was plenty that was mentioned throughout today's webinar. To everybody who attended afterwards, and again, this is National Falls Prevention Awareness Month. And again, so excited to have this different perspective and being able to educate from the first responders view. So thank you. I'm going to let everybody have another 10 minutes back to their day.
Perfect.
All right.
Great.
All right. Bye, everyone.
Bye, everybody.
Bye.
Bye.
Thank you.
Thank you.